In his latest op-ed, former FDA Commissioner Dr. Scott Gottlieb says the coronavirus in China is likely more widespread. I'm not laughing, I'm coughing. More widespread than the country's statistics suggest, and a global spread of the virus appears inevitable. Dr. Gottlieb joins us now. He's also a member of Pfizer's board and a CNBC contributor. I think instead of a vaccine, you might think we need to get a quick detection method that doesn't need blood or doesn't need to be sent out to a clinic to determine whether it is. And there's a way of doing that with antigens on the surface of the coronavirus.
Right. I think we're going to have outbreaks here in the U.S. We need to start preparing for that. That doesn't mean we're going to have an epidemic here. But to avert an epidemic, we need to do better diagnostic screening.
Not vaccines. Yeah.
And right now, the diagnostic test we have requires samples to be sent off. It takes a number of days to get a positive result back. What you really need is a point-of-care diagnostic that allows you to screen people out quickly. And if people, have presumptive infection, isolate them.
Can I just ask, do we know anything about the incubation? I've heard anywhere from 1 to 14 days.
Yeah, it looks like it's about a week. So you've seen a range of 2 to 10 days in some of the more recent analysis. Some people have said up to 2 weeks, but I think a rule of thumb should be it's about a week. That's typical of a coronavirus. So that's what we should be working from right now.
Do you think that the Chinese are over or
I want to ask you, as a former FDA commissioner, would it be irresponsible of you to give an actual estimate of what you think the actual cases are, or just say that we probably are underestimating by a factor of what?
Well, I think it's dramatically underestimated based on everything.
Dramatically a factor of what?
Tens of thousands. And, there's some analyses coming out that said that there may be as many as 300,000 cases in China right now.
And we're talking about 4,000. And you're talking about hundreds
the official
of thousands.
number versus,
Right. Also, remember, they only rolled diagnostics out to most of the healthcare facilities in late January. So there's a whole bunch of cases they didn't even test. So there must be people who passed away from viral-like pneumonia that weren't even tested that we'll never capture. If you put it in perspective in terms of the reporting that we have right now, we know the numerator, we don't know the denominator. So it does suggest that maybe it's less virulent than you would suppose based on the statistics that we have. That doesn't make it any less concerning.
When you look at the steps that they're taking, do you say this is an overreaction, complete underreaction?
Well, the problem is we don't know what they're really looking at. I think the Chinese haven't been forthcoming with information, so we've been patting them on the back for being good actors in this case because they're behaving better than they did with SARS. They're still not behaving well. They've concealed key information, including that this was spreading to healthcare workers, which they didn't admit to last week. So we don't really know the full scope of what they're facing. I suppose that they're facing a very large epidemic, and they're taking pretty draconian measures. Some of these are not going to work. The quarantines might not be effective.
0.0002 or whatever the influenza virus is in terms of mortality can add up to hundreds of thousands. If this is really 2%, which sounds okay, that's a big number.
Well, even if this is 0.5%.
If it's 0.5, and I don't know what, do you have a feel for what it might be? What was SARS? Was SARS really 7?
About 10, yeah.
10. Oh, I thought it was 7.
Higher in healthcare workers. But look, this does look like it could potentially be in that sort of middle ground between something that's contagious enough to spread very efficiently, but still severe enough to cause a lot of harm. Things that are very severe tend not to spread as efficiently because they get their host too sick. You can't go out and propagate it. This does seem to occupy that sort of middle ground, including that we seem to have a lot of asymptomatic spreaders here.
So you don't think that we need to panic in the United States right now, but you do think that there will be pockets of fairly significant outbreaks?
I think that we can control an epidemic here in the U.S. if we take the right steps in terms of how we address the outbreaks that are inevitable. I think China
outbreaks are inevitable here.
I think we should be conditioning to expect some limited outbreaks. That doesn't mean they need to be large, but we're going to have some sustained spread in certain small pockets here because there's a sufficient number of cases ex-U.S. Some of it's going to get imported. I think China probably missed the golden window to avert an epidemic in China. It looks like they're already in a full-blown epidemic. It seems to be across the entire country. And the question is, does this now become endemic? Does this coronavirus keep coming back? And this becomes one of the coronaviruses that now circulates regularly.
What you worry about vaping and all things like that, would you shut down these wildlife marketplaces where SARS came from? And this obviously came from that again. I mean,
well, we don't know that for sure.
Well, okay, but how many times does it have to happen?
Right. So one of the early cases seems to have arisen in November with someone who didn't have any proximity to that market. The market may have become a place where it got spread but didn't originate from there. We're not sure about that.
That'd be weird.
These markets have been a long concern of public health officials because they become a breeding ground for things to jump from birds to mammals to humans, with some kind of mammal like a bat or a pig as an intermediate step between a bird and a human. So we've worried about these markets in the context of a bird flu for a very long time, and China has taken some steps to clean them up, but they still exist.